So for those of you who are familiar with any psychology, this connects back to some of the work that Pavlov did with conditioning. And the idea is basically when you pair a stimulus with something else, those two things become connected over time. So initially, when you go to the movie theater, you just go to the movie theater and you just watch a movie. But that day, when you start to introduce the popcorn, and as a kid you have popcorn every time you go, and over time, you could just see that movie theater and you think of popcorn. You don't think of movies, you think of popcorn. These are some of the other things that I think psychology brings to helping people change their eating habits and change their weight. So for some folks, they're coping with other things like emotional or stress-related eating. So sometimes we'll help people learn alternative ways of coping with difficult emotions or dealing with stress. There's also something called binge eating or binge eating disorder, which is an eating disorder. So obesity is a health condition, and it's not an eating disorder, but there's a subset of folks who have an unhealthy weight who also have binge eating disorder. It's generally about 1 to 5% of the population. And for those folks, there's a different form of treatment that can be really helpful. So as psychologists, we play a really important role. And we do treat a lot of folks with binge eating disorder in our clinic too. And then we also find that people with other psychological disorders, in addition to an eating disorder, so with depression, for example, sometimes weight difficulties can come along with that too. So in those situations, we want to make sure that we are treating both and not just kind of paying attention only to someone's weight. I'll just finish. I'll ask, I guess, see if there are any questions at the end. But if there's something that one of you wants to ask while I'm going through, then you can just stop me. So the other important piece that I think, when I think about what we do, what my students and I do, one of the things that I think is important to consider, both in terms of helping people with weight difficulties and also kind of more globally thinking about what role we as a society can play, is thinking about the role that bias and discrimination, specifically weight bias and weight discrimination, play. So the prevalence rates of weight bias and discrimination have increased by about 60% over the past 10 years. And unfortunately, and sometimes surprisingly, you might expect that, oh, you only see weight bias in community samples, but it's actually quite prevalent. So physicians, students who are in training for a health profession, dietetic students, health professionals that specialize in treating individuals with weight and eating disorders, there's been research documenting that weight bias is prevalent across all of those samples. And weight bias means that people are kind of underestimating the role that biology, genetics, and environment play, and overestimating the role that individual factors play in weight difficulties. And what happens is, over time, when people are exposed to bias and discrimination, it actually can exacerbate weight difficulties, eating difficulties, lead to psychological difficulties like depressed mood. I mean, if you think about it over and over, day after day, just like other forms of bias and discrimination, it can be quite insidious. So there's been a movement to try to raise awareness of the prevalence rates of bias and discrimination, increasing sensitivity to some of these issues, and also addressing it in treatment directly when you're working with someone. So to kind of bring this back to what we do here, as I mentioned before, our clinic is part of LaSalle University's Community Psychological Services Center. And that center has a lot of different sub-clinics, if you would, within it. Each clinic is supervised by a licensed clinical psychologist who is a part of the psychology program here at LaSalle. And so our clinic, my clinic that I supervise, is the Healthy Eating, Healthy Weight Clinic. That's what we call it. So all of the entire clinic, including our sort of sub-clinic, provides low-cost sliding scale services to members of the community. We do not accept insurance. So we are really working with, we certainly have members of the community who are of higher SES and could afford more expensive services. And I think a large proportion of the individuals that we see, both in the subset of the clinic that I supervise as well as the clinic at large, are individuals who may not otherwise be able to afford services. So we're really providing an important service to the members of the community. So in terms of my clinic specifically, we provide individual and, when we have enough folks, group services. So the individual services, again, are focusing primarily for people who have eating and weight-related difficulties. And usually that's not the only thing that they're struggling with. So it's usually many other things that are going on at the same time, but our treatment is focusing primarily on addressing this piece. So again, we are not providing this cookie cutter approach, but more individualized treatment depending upon the person's needs. So we have this really in-depth assessment period where we try to figure out how we can best help the person. And then the groups, when we have enough people, the groups are a similar context. Ideally, they're anywhere from 4 to about 10 people and run usually about 12 weeks. So in addition to this, some of the work that I've been doing with students outside of the clinic are within the university and the undergraduate student in particular. So in terms of research, the students that work with me, we've been doing some research trying to understand factors related to eating behaviors in college students, particularly emotional eating, as well as examining weight-related attitudes and bias among healthcare providers in student health centers. So this is actually a dissertation that one of my students is doing. And so in conclusion, I just wanted to provide some additional resources if you're interested in learning more. There are lots and lots of different options, but these are some places where you can go to get some more information if you're interested. And I will send you the slides too. So So this first one, they have a lot of information about all of these things, but they have probably most information about weight bias and weight discrimination out of these 3 sites. This one, these 2 I think are probably pretty self-explanatory. Okay, and this is my email address. If you have any questions, you can feel free to email. So, any questions? Comments?
Now, so you help with students and like the community at the obesity center?
Good question. Yeah. So our clinic is exclusively focused on members of the community.
Okay.
So let me take that back. LaSalle students get services through the LaSalle Counseling Center. The only exception is there was one time when we ran a weight loss group and there were some LaSalle students who participated in that because it wasn't a service that was being offered at the time by the LaSalle Counseling Center. We will sometimes see students from other universities for a variety of reasons that I won't get into, but LaSalle students are seen through the counseling center partly because of the coverage that you have that LaSalle students get through the university.
And is the center open during the summer, like when we're not in
Yes.
school? Okay.
Yep. Yeah, so we're open year-round. We have evening hours, weekend hours. Sometimes the hours are changed a little bit in the summer, but we are staffed and run year-round. We close, I think, for 1 week over the winter break, like 1 week in between semesters, but that's really it. We also, I should note, we do not provide any emergency services. So this happens less with the folks that I work with, but we do see folks with lots of different presenting problems, and so we're not a crisis center, so if someone has an emergency, then we do not see them under those circumstances. We're just not equipped to do that. Good.
So the clinic is mostly student-run with your student?
Yeah, good question. So the way that it works is they are, all of the actual clinicians are doctoral students in training. So they have had at least 1 year in the program, and it can be anywhere from a second-year student all the way up to a fifth-year student. All of the students are supervised by licensed clinical psychologists, and that supervision could include both a group supervision as well as individual supervision. Meaning we meet as a group and talk about concerns or difficulties, review cases, and then also meet one-on-one. But all of the clinicians themselves are students in training. And every member of the community, this is actually across the board, anytime you get treatment anywhere, you get an informed consent. So you're told, all the people who come to our clinic are told, your clinician is a student in training and they are supervised by a licensed clinical psychologist. So they all know.
Now I assume all the doctoral students are through LaSalle.
Yes.
They're not coming from other schools.
No, correct. They're all LaSalle students. Yep.
What would you say is the average age range of people who use the
Good question. I can speak to my team is I would say, I also think it's a function of the population. So most of the folks that we see are probably middle-aged women, most of whom are probably African American. In the clinic, I would say probably, well, middle-aged to older women are the ones we see. In the clinic, I think there's probably a little bit more age range. We do also have they're called clinic teams. We don't call that in the community, but we call that kind of when we're referring to the different sub-clinics. So there's another sub-clinic that focuses specifically on providing services for children. So in that situation, obviously, the age range would be lower.
So can just anyone from the community come and how do you promote it? How do they find out about it?
Yeah, that's a great question. I feel like we could use some help with that, honestly. It's a lot of times it's word of mouth. For me, I have tried to spread it through word of mouth, through talking to physicians, the contacts that I have just based upon who I worked with before I came here. Some of the supervisors will present grand rounds, so we'll go to different hospitals or different medical clinics to talk about our services, but we don't have any advertising. We have some pamphlets. I brought a couple with me. So I think that's one of the things that we could probably use more of. We don't have an advertising budget or anything like that. I did actually try to advertise through Craigslist once, and nothing came of it.
What are some of the most common eating problems that you see or deal with, and what do you think causes them and stuff like that?
In our clinic, so what I've found is that usually when people come to our clinic, oftentimes they've tried things on their own. So I found, this is just my experience, I found that it's pretty rare for people to come and have no knowledge at all. Some people do. Some people have very little nutrition knowledge or very little knowledge about how to make behavior changes. And I think many folks have tried a little bit on their own and have found that it's been really difficult. So they're coming for some extra help. And usually it's very difficult because they also have a lot of other stressors and or are experiencing depression and or anxiety and or social stress. And it really may be so it may be social stress and environmental stress and depression and anxiety and many other health conditions too. So it's kind of this confluence of factors that just really makes it very difficult for people to implement the changes that they feel like they know they should make, but they can't really do. They can't figure out how to quite make it stick. So you asked how do we do that too? Was that the second part of your question? Or did that answer your question?
I think that answered my question.
Okay.
But how is actually another question I did have.
Yeah, that's a harder question to answer. So the rates of successful weight maintenance are not as great as we want them to be. So a lot of people can lose weight, and when it gets really hard is to keep that weight off. So we as a field, I think, aren't really great at saying, all right, we know that if you do this, you'll definitely be able to keep that weight off. There are some factors that we know are helpful, like that self-monitoring actually, or weighing oneself. But as far as we have this prescription to say, okay, when you're having XYZ difficulties, we know if you do this, then that will definitely work. We're not quite there yet. So usually what we do is that's why the individual assessment is so important. So let's say, for example, we know that someone is having trouble sticking to consuming certain foods because they are also experiencing depression. So then we would help treat the depression in addition to that, so that we can kind of get rid of that barrier to making and maintaining those healthy changes. For someone with an eating disorder, like binge eating disorder, there's a treatment. There are a couple of treatments that are effective, one of which is called cognitive behavioral therapy, which has to do with, this is an oversimplification, but kind of changing the way that you think and see things, and then that in turn helps you change the way you feel and the behaviors.
What was that called?
Cognitive behavioral therapy. I saw it bring it up. Did you ever hand it?
No.
Oh, okay. Yeah.
I think you might have mentioned it, but how long, I guess like on average, how long does the person keep coming back? Like, how long does the client keep coming back? Like a couple weeks or a month or a long time?
Yeah, so the groups are usually around 12 weeks. The individual treatment, so we do have it's a manual, but it's a flexible manual that we use. That's 20 weeks. Sometimes people will say, I'm ready to be done after 20 weeks. Sometimes it'll take a little bit longer. There really is no set time.
So it's not
I
like,
would say, go
it's
ahead.
not like, it says low cost, right? And then you don't say, all right, well, I'm going to pay for this amount of weeks. It's
No.
just you pay and then.
No, although what we do, I mean, I think you raise a good point, which is, does someone come in and then 6 months into treatment, are they thinking, oh my gosh, why am I still here? Oops. So we do definitely talk about that. We talk about the expected length of treatment, and usually about every 8 weeks, we revisit where treatment is, what the person's treatment goals are, and how what we're doing is consistent or inconsistent with those goals. So there's a lot more autonomy there. Yeah.
You said like you guys don't really accept extreme cases.
Yeah. So let me be clear about that. Again, I think this is less common with the folks with whom we work, but there are 24-hour emergency psychiatric facilities for people who are in crisis. And so by crisis, I mean people who are having thoughts of hurting or killing themselves or hurting or killing others. And people who are in crisis, we don't work with them directly at that moment. So we do have people in our clinic who may have some of those thoughts, but if it's at that moment or if it's when we're closed, we don't have people on call. That's my answer.
Okay. Look.
What got you interested in this, like eating disorders and just nutritional awareness type things?
It started actually with a class that I took, a health psych class that I took as an undergrad, and I'm laughing because I teach health psych now. Isn't that the class you took with me as a health psych? Okay. So it actually started with a class that I took as an undergraduate student, and I think I just became interested initially in health psychology, and then the more I learned, the more interested I became specifically in question.
One more?
Yeah.
Okay, keep going.
It's okay, I don't mind.
So, have you heard of the Exploring Nutrition program at Allenstown?
Yes.
And what is there any interest in joining? I guess that.
I am part of it. I just don't know.
Okay. So you don't know, like, is there any like comments you have on that?
I know less about that.
Alright.
I'll just leave it at that. No, I mean, so originally, a year or so ago, when it was being developed, there has been and probably will continue to be ongoing discussions about connecting what we do in our clinic to
So
the broader
if
mission.
you-
So yes, definitely.
So if you try to get more involved with that, would that be something you try and connect to that program?
Yeah,
Okay.
sure, absolutely.
Okay.
Yeah.
Okay, great job. Thanks very much for coming by, and